Rhode Island is experiencing an overdose epidemic. That's the news today from the Department of Health.
A new report finds fatal overdoses increased drastically last year, and there's debate over the reason why.
12 News reporter Brendan Truitt is live in Providence with a look at where this is happening and what the state plans to do about it. Brandon?
Well, Shannon, Rhode Island lost more than 380 people to accidental overdoses last year. That does not include suicides. The state is pinpointing a few reasons for the increase.
People are dying from the pandemic, yes. People are dying from overdoses, yes. But there's all other kind of harms that are going on in our state as well.
Tonight, Rhode Island facing the reality of multiple health crises. New data just released showing accidental overdose deaths are up from last year.
Office report.
During a virtual meeting Wednesday, the state revealed more than 380 Rhode Islanders overdosed last year, up 25% from 2019. Most of them were men, but that's where the differences end.
This has been all over the entire state. Like every city and town of Rhode Island was affected.
The state says they saw a steeper increase of overdoses in Black Rhode Islanders, as well as all races ages 45 to 54. Right now, they're working to figure out why.
And I think what you saw is the pandemic accelerated that increase.
Dr. James McDonald with the Department of Health saying there's more to it than that. Simply put, more drugs are in circulation and they're becoming more deadly, often mixed with fentanyl, whether users know it or not.
I think that's part of what drove the increase in deaths. It's just the increase of potency of product, and just the illicit drug trade did not take a hit.
And states across the country are seeing this similar trend here. In Rhode Island, there are several bills making their way through the State House aiming to help solve this problem. I want to note here, the state has a free 24/7 hotline for anyone that is looking for help, or if you know anyone. We've also put that number in this story on our website. That's WPRI.com. Live in Providence, Brendan Truitt, 12 News.
Along with COVID, Rhode Island is still dealing with another health crisis. New data released today shows fatal overdoses went up drastically last year and that no community was spared. 12 News reporter Brendan Truitt talked to the health department today about what they plan to do about it.
What's happening here in Rhode Island is being seen in states across the country. This task force was created by former Governor Gina Raimondo, and they've pinpointed two main reasons for last year's increase.
This has been all over the entire state.
The data is decisive. Fatal overdoses in Rhode Island are becoming more common.
Every city and town of Rhode Island was affected.
The state's report finds more than 380 people overdosed last year, up 25% from the year before. These cases are classified as accidental. They do not account for suicides. The data shows men make up 3/4 of overdoses. Every race saw an increase too. The state identifying these 5 cities and towns to have the most fatal cases.
And I think what you saw is the pandemic accelerated that increase.
Dr. James McDonald with the Rhode Island Department of Health saying it's not just the pandemic to blame. More drugs are coming in, and many are mixed with fentanyl, whether users know it or not.
And I think one of the things you see in 2020 was it became a more potent epidemic.
That is positive, particularly to the families.
Governor Dan McKee on the call Wednesday, the state saying they have a multi-system approach to this. The first step, decreasing supply.
We couldn't get toilet paper in 2020, but the illicit drug supply did not change. In other words, it kept moving through into our country.
And the state is offering a free 24/7 hotline. If you or anyone you know needs help, you can see the number on the bottom of your screen. I've also put it in this story on our website. That's WPRI.com. In Providence, Brendan Truitt, 12 News.